Hi guys, so this is our discussion number three. Just kind of here to discuss some groups. We've got chapter 32 and 33 for this time around. Um, Starting with chapter 32, post-processing operations in practice. For me, one of the things that I kind of had a question, sort of, and it's something that I have noticed at my site is
Mm-hmm.
there's a lot of manipulation of the image. Um, the image looks certain way, and we can't with our system, we cannot, I didn't even know that was the thing. We cannot change the S number, but I do see them kind of messing with the brightness and the contrast and just trying to make the image look better. Even when there isn't a prosthetics, I know throw them off. Images, of course, are kind of wonky, but even when there isn't a huge need, um, images still kind of like mess with a little bit. And so I think after one of the lectures with Professor Steele, he said, just don't mess with it. Just send it as is, and that's what I've been doing now. But um, just kind of seeing that a lot at my site, and um, it made me
Yeah,
realize,
I see that.
yeah, it made me realize that hey, the image looks gray. I'm still a student. I don't really know what I'm looking at, like what looks good, what doesn't. But I was instructed, that's the best that it looks like. And so, but I'm just trying to understand, what the texts are trying to do, what they're trying to, I know it's mostly just personal preference, but what they're aiming for. So I'm assuming it's just part of my growth. I don't know if you guys still also see that at your sites.
I see that too, where like I'll take an image and then they'll like, oh, well, the EI will change, watch, and then they'll mask it, like bring in the sides, I guess that's masking, right? And the EI number changes, but then, okay, I can understand if we take out areas that have direct exposure and are black. But then I've also seen them, you know, cut out anatomy to make the EI number better.
Oh,
So, but it's not, I'm not the tech, so I
yeah.
just kind of observed. So yeah, I'm glad you brought that up because
We're
I've
like, I like what
wondered and had questions
we're
too.
I like what you said. We're not here to point it out to you. Like I'm not the tech, so I like that. And I think that's been a big one.
Yeah,
Like we're not
in
here.
my head I go duly noted, and then I'm like, okay, I can understand like if you take out the direct exposure, right, for like when you do a merchant sunset view of the knee, and it's always like you have a prosthetic in there and it's like this funky EI number, like at my it's always like 1,000, but then they're like, well, watch this, and they'll like come in really close, and sometimes even like, yeah, crop out anatomy. And in my head, I'm like, oh no, but they tell us not to do that, but it has like my marker on it.
Yeah.
So yeah. Are you guys experiencing that also?
Yeah, I feel like maybe since you're saying that they're not changing the SID, it's not as like it doesn't change it as much because I know the brightness and stuff, the doctors can still revert back.
Yeah.
But at my site in specific, they will go out of their way to change the SID to make it better. And that's where I'm like, I know we're not supposed to be doing that. Like, and yeah, I've noticed that too, where they will cut out um like anatomy or anything. Not important anatomy. I feel like that's when things get like that's what you're looking at. You probably shouldn't be cutting out to get a better SID, but yeah, say you took like more than you were supposed to, they will crop it out.
When you say
Yeah.
change the S
And I
number,
always thought that,
does it
yeah,
change the way the image look, like the contrast and like the grays? Does it change that at all, or not really?
yeah, when you crop, it will change the grays and everything, and it'll make the picture look pretty different.
Yeah. Okay.
mhm.
That's interesting. Okay.
But I mean, it was my understanding that if you crop out any anatomy, like what if there's a cancer on maybe not in the wrist, but like further up the arm, and you were like, oh, I'm only supposed to take a wrist, and you cut that out, you could be liable then because you didn't catch, cancer. Not that you didn't catch cancer, but you didn't see it, you didn't mark it,
Yeah, I
for
don't
it to be
think
bad.
that would be too bad of a problem because then I feel like if that was the concern, then they would have ordered a forearm or something like that. Like our job is to image what they order. So
I
even if we did crop
understand
it
it.
out,
We can lose our license if we cut out anatomy and if they discover there was a cancer in there, because I think a lot of cancers are caught like that, because a lot of people don't present with symptoms of cancer. For example, like my dad went in for a different imaging, and that's how they found his cancer. So
So maybe it's
yeah.
like, maybe it's something more like just kind of building on that, that you take an image of the hand, but then
Mm.
the patient says something, and then you're like, well, I'm going to leave it open just a little bit, and then you notice something. So you're not necessarily going to take an image of the forearm or the arm, but you're just going to leave it a little open and probably just make notes. Hey, I noticed an anomaly, blah, blah, blah. This is the reason why I left this.
Yeah.
So maybe something more like along the lines of that. Like
Hmm.
you're not gonna do like a full on forearm series, of course, but you're gonna be like,
Right.
I left
Right.
my collimation open just because I think you should see this. You should consider placing, following up on this, or placing an order for this. And I just wanted to bring this to your attention. So as long as you kind of cover your end of it, you're like, hey, just so you know, you ordered this, but I saw this, so. But that's kind of cool.
Yeah. Or
Said, like, they inadvertently found something that helped,
yeah, but it was so late in the game. But yeah. But I mean, like for example, like for me, like sometimes I don't collimate correctly, right? And so the techs I'm working with, because I'm still learning, the techs will cut certain things out, and I'm just, oh, I don't think we're supposed to, even though I made a mistake, I don't think we're supposed to cut off anatomy. So I think I do too many mistakes at this game and at this point of the game, and I think I'm doing too many repeats after what he was saying about cut down on your repeats, because I'm like, I'm not really sure what the deviation is where like you should repeat an image or you shouldn't repeat an image.
I feel like that's kind of unfair though, because I feel like there's days where I will just have repeat after repeat after repeat, and it's like, and then there's days where I get perfectly fine. So I feel like it's not even a thing of experience. It's just there's certain days where you get certain patients that you just can't get down.
Oh yeah.
Some patients you just want to tape their whole body down. Stop moving.
I they hired a new tech over here, and they were like, so he wanted to do it, and so this is a side note, you guys. In addition to this, I guess so when we finish the whole program and everything, we get our license. There's a wait period. He's like, you guys are going to be waiting for 3 months without practicing any X-rays, and he's like,
Oh no.
yeah, and he's like, he was telling me, he's like, hey, do you mind if I do this? I was like, yeah, yeah, go for it. So he was trying it, and he was telling he kind of he didn't position them properly, so he was just a little off, but he's like, oh, let me do it again. I was like, okay, I got you. And then, I clicked the button, put a new image, and he's like, oh, you know how to do that pretty well. I was like, yeah, I've had my fair share of repeats, so I know where that's at. But like, you're still students, like, we're still, we're gonna have a good fair share of repeats, and of course, some days, like Josie was saying, they're better than others, because but I was like, I know where that button's at, let me do another one.
Right. And then sometimes I'm like, maybe I'm being too critical of my obliques, like, because I'm like, well, it's not perfect. And they're, the text is like, oh, just put it through. And I'm looking at it, I'm like, but that is like so off in my head. I'm thinking that, right?
Yeah.
So I really don't know what is passable and what's not passable still.
At my clinical site, at Cottage in Santa Barbara, they usually take images of more than what Merrill's is saying, so they never crop any of the anatomy because they always
that's
want to see more. And then I only see them like windowing or leveling when like I've taken an image, for example, of a peds and I put in the recommended technique, but it wasn't enough, so the image was underexposed. So they were trying to see if they could make the image better to where they
Mhm.
wouldn't have to repeat, even though it goes against what we're learning. That's the only time I've seen it.
Well, that seems like a really good place to work at because they're protecting the patients.
Yeah.
And then at my site, because I guess it's a trauma hospital, we have our collimation pretty big, so they're not really cutting it down. They only adjust the brightness. That's
Where are
about
you
it.
again?
VCMC.
Okay.
It's interesting. That makes sense. If you have like a more of a trauma hospital, you want to leave it open. But then again, you also have like, you know, either neck braces or, if they're coming in on strapped down to a stretcher for whatever reason, whatever it is, that makes sense, I suppose. But yeah, that's
Right.
the biggest thing I've seen is adjusting that.
Because of movement, and then there might be complications farther away than from the site that you're x-raying.
Yeah.
Yeah, or
That
if they
makes
don't
sense.
stay still, you have all that collimation just to in case they move.
Yeah,
So we do have
literal
like a lot
wiggle.
of like patients and people from the jails come in.
That makes sense.
Yeah.
Any other concepts that you guys are struggling with? Or how's everything else going with the other chapters? You guys?
I had a question about grids. Like at my site, they'll use like they're, Steele, what Professor Steele was saying in the lectures that, and we learned this too, that using a grid increases the patient dose and you only need to use it when a patient is extremely bariatric. But at my site, we use the grids on abdomens, on not really extremely bariatric people, just like slightly heavier. And I'm wondering what you guys are seeing.
I've had Bruce tell me, I can't remember the exact measurement, but he was saying like anything like wider than the knee. So like from the knee to the shoulder, like anything in between needs a grid.
Yeah.
I don't remember if it was like 3 inches in diameter or what the exact measurement is, so we can always double check.
Okay.
But yeah, like hand, forearm, humerus is fine, but anything like above the knee.
So did you guys use the grid on the chest?
Yeah, virtual
Mm.
grid. Yeah.
Same here.
And
Okay.
The one
abdomen.
that's built into
The
the
virtual-
Bucky. Is what you're talking about?
Yeah, and
No,
then in the body too, there is.
Yeah, and then we have like a separate grid for scoliosis that we swap out when they do the series.
Oh.
You guys have over there
Is that on?
a really nice machine that does the scoliosis shots, don't you guys?
Yeah, they said at our site's like the easiest place. If you want to get your scoliosis, do it there.
Yeah, that's what I heard too. And I was
You
like,
don't have
oh,
to.
okay. That'd be kind of cool to check out.
Yeah, so I'm
Good because I need
gonna
that.
try and do that.
And I'm going there.
Yeah,
But I guess
all the
it's
tech
always
said that.
like good to think too, like, okay, it is raising the patient dose,
Yeah.
but then it's cleaning up Compton scatter, which affects everyone. So in a way, it's like it's good to
Right.
use a grid.
I like how the virtual grids don't add to patient dose. I think that's pretty cool, but it doesn't reduce scatter. So I don't know.
We definitely up the technique with the virtual grid.
Okay.
It's kind of
Like
rough.
for an example, it says 80 at like 6.3 for virtual grid. And then if you don't use it, it goes all the way down to 60 kV.
Oh, wow,
Well, that's interesting because in the lecture, I just finished watching it, and he said the use of grid software is shown to reduce patient dose by 50 to 70% instead of, when you use in lieu of using a physical grid. So,
That's just with Fuji. So I don't know.
okay. Anybody else have thoughts on that?
it's good. Is everything else going as far as like um getting some feedback from the tech from what we've techs that we guys have like been doing, everything kind of lines up with, well, I'm pretty sure it doesn't, because the textbook is one thing, but clinical experience is something else. Like we all know that. As we've learned, textbooks says to do it another way, but realistically,
Yeah, all our techs has told us like learn whatever the Merrills or whatever for a class for the boards, realistically, you're not gonna use any of that when you're a tech.
Yeah, that's about
Yeah,
sounds about right.
sounds about right. I'm still trying to visualize like with the portable, all the different angles and the variables. I run around like, like with my arm all the time, going like this, trying to figure out where I'm supposed to point the tube when the
The
patient's in like position.
portable takes a while to get kind of like a nice handle on. Where are you at again, you said?
I am at AG, Rio Grande, but I go every week. I trade off between the outpatient and the hospital. So it's like I have to get used to the equipment and like how things are done each week. So it kind of throws me, but I figure that's good practice.
That is kind of nice, yeah.
Yeah.
That's pretty good, you guys. Any other questions that you guys wanted to kind of go over or anything um that has kind of you guys think you want to bring up?
I was kind of confused about how heightening the KVP affects the model. I wasn't sure if it increases model or decreases model.
When it comes to bringing up the KV,
Yeah.
I'm assuming it would bring if you bring it up. So the KV usually focuses, if I'm correct me, you guys, usually the KV focuses on penetration. Um, if you increase the KV, you're going to have better penetration of the anatomy. So like for example, if you're doing a hips versus like a pelvis and an L spine versus doing a hand, we use a higher KV. Um, so I'm assuming that would bring it down, but then you also have to have an adequate mass so that you have enough photons to penetrate that yeah, because the KV is more penetration. So will it get through? And then you need the quantity like on the mass. So that's actually a good one. What do you guys think?
Um, when he was talking about model, he said that the increase in KVP was no obvious changes in image quality, no obvious changes in model.
Okay, yeah, I wasn't sure if it was like it increases, decreases, or it just has no significant change.
Significant change within the parameters of increase by 15%.
Would it be more directly connected to like the mass or the algorithm?
Let's go back to that little group.
I mean, I think that section was just mostly talking about how it's better to increase KVP than increasing mass. So I think maybe that's why model was mentioned.
I kind of think just based off of like what we learned in Chuck's class and then that chart that we have, it says that KVP increases the grayscale in contrast, which I think, yeah, like more penetrating power would reduce the model because you'd be able to see more. But I think that's just a guess.
Now we're gonna have to go back and look.
That's actually a good one.
My question was on deviation index because we always use the EI number, but I was just wondering if anyone's seen the deviation index measurement on any of their equipment or like where to find it.
I haven't.
Is that number that says like a +1 plus like 2?
Yeah, and I feel like I've seen that like on windowing and leveling, but I don't know because it's like the +1, the window and level, but I don't think that's related.
I think I've only seen it on the portables, not on the actual console.
Yeah.
Yeah,
What kind of portable do you guys have?
GE.
I
Okay.
heard Fuji, but I don't know if that's even deviation index. I think that might be something different.
Right. Didn't he say that was one of those things we should ask the technician or the QC person? Is they would know?
Probably.
I
Okay.
asked my QC person on the film speed, and he was like, I have no idea. He's like 100, 200, 400, 350. He's like, I have no idea. And it's like one of the techs that is assigned the QC, the QA and the QC. And I'm like, don't know. So
And then I do have, like, I looked in the textbook a little bit about it, just to give you guys a FYI. It's just one indicator of the image quality, it says, and it's derived from pixel values. So it's not a measurement of the patient exposure, kind of what Professor Steele was saying. And then it says it is taken from exposure data at the image receptor, not at patient's surface nor within the patient. So kind of like the EI value.
Okay.
But yeah, just curious if you guys know where it's located at.
so it's information derived from average data of exposure and whether we hit those average numbers, whether we're above or below it.
Yeah, basically hitting the pixels within the image receptor.
That's
Okay. We'll probably just have to go deep into the settings to find it. That's something we can just ask at our sites and then like talk about it later. See
that's
what-
definitely something we can just, yeah, you're right. Any questions, Willie? Anything else?
For me, I thought it was let me see, that you can't collimate with CR. And I was wondering if any of you guys have CR at the sites you guys are at.
No.
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 I do have CR, and you can collimate when you're taking it. And then I think you can crop it after, but one thing that I noticed is you can't rotate the picture. So if you're like taking a wrist and it's like this, it's gonna
Mhm.
show up like that in
Oh,
the
wow.
end. Yeah, so you need to take it perfect.
Oh my gosh.
Mhm.
Do you use CR often?
It's just for the rehabilitation patients, so
Wow.
not very often, but I've had like a couple little tries on it.
So do you take it and then take it to like the dark room type thing, or
No,
how does
no,
that
that's
work
just
out?
film.
That's not film. You
Oh,
put
my
it
bad.
in the reader, and you see the lights change.
You
Or-
put it into the reader.
Oh yeah.
I'm surprised because I always thought cottage was like so modern, right?
Well, that's the building next to cottage. So we go over there, like if someone were to get a surgery and then they need to watch them for 2 weeks
Okay.
before they like can go home and do physical therapy. That's where they're at.
Okay.
I think that what happened is CR probably didn't update their systems with digital radiography, so they didn't like update the rotating or any of that. So it's pretty basic. Even though it's Fuji in the same system, it's not updated in that way.
Okay.
10 minutes, you guys.
Anything else?
That's got to be annoying that you take a decent image and you're like, oh, that's actually pretty perfect, and then you're like, rotate.
Upside down.
Yeah, you're like,
You're all RT note to radiologists. Please stand on your head when viewing. Just kidding.
that's got to be like you take a
Yeah, you can't move the plate underneath them. You have to move the patient or the tube, which sometimes it's hard to move the tube because the tube is so old.
Is it a stationary plate that's like attached, or can you like pick it up and
No,
like
I just did a tabletop, but like the person was in a wheelchair and then they didn't want to reach over, so then I just moved the plate, kind of how you would with digital radiography. And then I was like, oh, now I can't rotate it. So
that's
my wrist is like,
Oh no.
that's annoying.
Yeah. That would get me so flustered. Okay, know the quality criteria, because you mentioned that several times. So know all 8 of them.
Any other questions that you had, Kendra? That
Not that I can think of at the moment. Just the ones that I was kind of wanting to compare sites and what you guys had seen.
okay. I think that does it, unless you guys have any other questions. You know, it's good to see the differences across the sites, and it's interesting how it's like you were saying, Kendra, how some of the sites, you know, as new as they might be, you know, are still using some of the CR technology. We don't have the like that opportunity to go to like the occupational um, site for us. We're just stuck in the department or you know the ER. I'm assuming they're probably using CR2 over there, but I don't know. It'd be nice to kind of get hands-on on CR, but from what it sounds like, not really. That'd be kind of just interesting.
I
Oh, like this was
think
used.
that's why we changed site.
Yeah, I'd be like, oh, this is cool. This was used like 10 years ago, but I'm like, okay, never mind. Just kidding. Like,
Like, nobody else is using this except for this site. Okay.
it'd be kind of interesting, you know, to see it, you know, you know, experience it. But you know, it's nice to hear and see the differences across the sites because we are rotating pretty soon, and it's an
Yes.
experience to understand how some of the texts work, how some of the sites work, and how we're applying some of this information that, you know, sometimes we feel like a class, some of the didactic learning isn't applied in the field, but it is, you know, and so it's kind of cool.
Mhm.
Um,
Yeah, and like Professor Steele said, that the culture that we're learning, we need to slowly, as we become techs, it'll slowly be implemented into whatever site we start working at, because we're bringing this new education in with us. So we might not see it being implemented right now at the sites because there's techs who got their education a while ago.
that's true. That's true. Well, unless you guys have any other questions, I think that wraps it up for us.
Thank you.
All right, you guys, take it easy.